Since early in the pandemic, the presence of COVID and other respiratory viruses in the county have been monitored through wastewater surveillance. Dr. Christopher Longhurst of UC San Diego Health puts the recent increase in viral load into perspective.
What we've seen recently is the greatest increase in COVID virus and wastewater since the Omicron surge of a couple of winters ago. But of course, these are different variants, and we're not completely sure if this is predicting a larger outbreak or really reflective of the fact that COVID has already gone up.
Even though the infection numbers are similar to those in January 2022, Longhurst says the good news is there are far fewer hospitalizations compared to then.
We do have some patients at UCSD Health who are admitted for COVID, but we actually have more patients who are admitted with COVID, but for other reasons like pregnancy or trauma.
Some of the reasons for the current low hospitalizations are less severe variants and people's immunity, but he says that could change.
We will likely see more hospitalizations in 1, 2, 3 weeks from now than we're seeing currently.
The reason for the current spike is simple.
We just finished the holidays. And so this is a normal occurrence every winter. Before COVID, we traded other viruses like the flu and RSV. And in fact, influenza and RSV are also quite high right now. So it's common that people will have had the sniffles at the holiday parties and exchange those viruses.
Longhurst encourages those who are high risk to keep up to date with vaccines and boosters. Melissa Mae, KPBS News.